Thank you so much for joining us today. We realize it's challenging to capture an audience of people who are feeling burnt out because the last thing they want to do is listen to another webinar. So we designed this webinar to be very interactive, helpful, and practical. So we want to thank each of you for sharing a small part of your day with us. So this webinar is a collaboration between the Canadian Health Workforce Network and the French Health Network of Central Southwestern Ontario. And they work together with the National Association, La Société Santé en Français, to increase French language health services for Francophone and Acadian minority communities across the country. So there's 3 of us here today. Gabrielle and myself will be facilitating the English webinar, and then please feel free to promote and attend the French webinar that'll be happening next Tuesday, same time, same place, with Gabrielle and Houssem.
So I would like to present first, Dr. Melissa Corrente, which is the Ontario Certified Teacher and a Senior Research Associate at the Canadian Health Workforce Network at the University of Ottawa. She is currently involved in a research project focused on building psychological safety in long-term care. Dr. Corrente teaches for the Schulish School of Education at Nipissing University and preparing the next generation of teachers. She is passionate about infusing mental well-being into various workplace settings. Melissa is the proud mother of 2 children attending a Franco-Ontarian school.
Thanks very much, Houssem. So I'm going to flip-flop and introduce Houssem. So Dr. Ben-Ahmed is a Senior Research Associate and co-lead of the Mobility Migration. Also...
You're on mute, Melissa.
Thank you. You think I would have figured this out by now. So Dr. Ben-Ahmed is a Senior Research Associate and co-lead of the Mobility, Migration, and Integration theme at the Canadian Health Workforce Network, and also a part-time professor at the University of Ottawa. He holds a PhD in nursing from the Université de Montréal and completed a postdoctoral fellowship at the University of Ottawa. He's an emerging nursing workforce researcher, and his project focuses on fostering nursing retention and integration, dismantling dehumanizing practices, and implementing innovative pedagogical approaches. So in 2014, he founded the Collaborative Alliance of Research and Education for Nursing Empowerment. This is an international research hub aimed at fostering collaboration between nursing and health sciences researchers from both developing and developed nations, particularly in Canada and the MENA region.
Thank you so much, Melissa. And I would also be happy to introduce our colleague, Gabrielle Laurin, who is Métis of Descent, is a proud Franco-Ontarian with a professional experience in social work, respiratory care, and French language education in marketing and communications. Gabrielle is actively engaged in her community. Throughout her career, she has managed projects and events with community organizations and has served as Master of Ceremonies and at numerous Francophone and bilingual events. She is now focused on advancing French language health services on regional, provincial, and national levels as a project coordinator at the French Health Network of Central Southwestern Ontario.
So as is customary in Canada, we start with a land acknowledgement in the spirit of reconciliation, acknowledging colonial legacies which impacts to this day. So I'm presenting to you today from North Bay, Ontario, which is the territory of the Anishinaabe, with lands protected by the Robinson-Huron Treaty of 1850. I'm really grateful to be able to live, learn, work, and raise my family on these lands. So just to give you a quick overview of our time together, we're going to start with a little bit of a reflection activity, followed by a sneak peek at the Health Worker Burnout Toolkit. And then I'll pass the mic over to Gabrielle to provide a highlight of all the Equity Link resources that are available, and then we'll end our time together with a discussion. So feel free to use the raise hand function on your computer, or feel free to type in the chat to respond to any of the above questions. The first question that I'd love to ask those of you who are attending is, have you or your organization ever used an evidence-informed strategy to deal with burnout? And by evidence-informed, I just am referring to an approach that integrates research alongside practitioner expertise. So for example, maybe a survey is sent out to your organization, to your staff members, and then a program's implemented based on the survey results. So I would love to know if anyone has ever utilized a strategy to deal with burnout, and kind of how it went. So I'll just open up the floor. You're welcome to chime in, to type into the chat. We're just trying to provide a little bit of context and see where kind of everyone's coming from. And if you've never used an intervention, then you've come to the right place.
So here, like we have two comments from Patrick and Kate that they have not, but they are excited to learn more about the toolkit.
Amazing. I'm curious if anyone has experienced any barriers. So maybe if you've felt burnout before, you've experienced it, maybe coworkers or colleagues have experienced burnout. What barriers have you seen, have you witnessed, have you experienced that really impede you from accessing resources to help with burnout? So any barriers like time, maybe unsupportive leadership. I'm just curious if there's any barriers that anyone's experienced so far. And I can share a barrier that we experienced. So we worked with a bunch of different clinical sites, and one of the barriers we found is there was actually too many resources to choose from. I think sometimes when you provide too many options and too many choices, when you're already feeling burnt out, it can be very overwhelming. And you just kind of look at all of these options and you're like, well, you know what? I'm too tired to even pick one of these options, so I'm just not going to engage at all. So that's one thing that we found working with healthcare organizations, that if you provide too many options, it's really overwhelming. And if you're dealing with a burnt out workforce, it can be very challenging to actually choose one and act on it. But yeah, if there's any barriers, feel free to type it in the chat. And then we'll move on to the last question. What supports would help you feel more supported in dealing with burnout? So oftentimes, and this is why we created this toolkit, oftentimes healthcare workers feel like the onus is on them to quote unquote fix themselves. So it's a very individualized approach. So if you're feeling burnt out, it's like almost your fault. So we kind of wanted to flip the script and talk about what system and organizational level factors are in play that are really, exacerbating these feelings of burnout. Because if you can't be well during your workday, it's really difficult to combat burnout. So I'm just curious if there's any supports that anyone feels would be very helpful in supporting them when they're feeling those feelings of emotional exhaustion. They're not feeling satisfied in their work anymore. Yeah, any suggestions, anything that you think would be important? And I recognize everyone's probably eating lunch while listening, and that's totally fine. One support that I found helpful with working with an organization is kind of like reducing that stigma. So they had open conversations about mental health, and it really helped break down the barriers of when managers and leaders talked about mental health and that it was okay to access and like here are some supports, then employees felt less stigmatized and they were more likely to talk to their peers about it. So I think having a supportive manager and leader is really important when we talk about burnout and how to support someone experiencing burnout. Even offering choices like a flexible work plan, or if someone's off because of mental health reasons, trying to provide like a supportive return to work can be really helpful as well. But if you have any insights on any of these three questions as we go through, feel free to just type them in the chat and we can talk about it. We're going to have a discussion period at the end. So we're happy to engage in a dialogue about anything that you've used, any barriers or supports that you've experienced. So we'll move on to introduce the toolkit. So the Health Worker Burnout Toolkit was funded by the Canadian Institute of Health Research. And the purpose of our project was to address the harms of the pandemic on the health of health workers. To achieve this, we curated evidence-informed resources and we developed the Health Worker Burnout Toolkit. Then we implemented and evaluated the toolkit with customized interventions across 4 different clinical sites. So what you'll see on the screen is the homepage of the bilingual toolkit where all the interventions are housed. So you can enter it from English or from French. And we intentionally organized the toolkit to include 4 levels of interventions, and we included system level interventions at the top. We did this intentionally because we wanted to focus on policies at an association union level, collective agreements, government action or advocacy. And then we intentionally wrote organizational level interventions underneath. And this focuses on policies within an organization, such as leadership development and training opportunities. And I heard this analogy during another webinar, and it's really stuck with me. So I wanted to share it with all of you today. So culture is like a pickle jar. You can't blame perfectly good cucumbers for turning into bad pickles. You have to examine the brine they're in. So we really need to examine the culture of the brine of healthcare, including leadership, systems, and environment in order to help healthcare workers deal with burnout. So then we go on to team level interventions. And they focus on things like peer support, mentorship, and leadership within a group setting. And then individual focuses on worker empowerment or changes in work culture. And as I mentioned earlier, we intentionally excluded interventions that place the onus on the individual to quote unquote fix themselves. So on the left-hand side of the screen, you'll notice a filtering system where you can search based on a variety of categories such as audience, focus of the intervention. So we looked at different topics like promoting mental health, managing workload, handling conflict, bullying, and harassment, and confronting discrimination. You can also search by healthcare setting, format, location, cost, and of course, language. So if you're just specifically looking for French resources, you can just click on the language, click bilingual, and all of the resources that are in English and French will pop up. If you're just looking for a podcast, for example, you can just filter by podcast, so just by the format. So that's super helpful if you're just looking for something targeted. So here's one example of a system level intervention. It's titled Caregivers in the Workplace, Tools for Employers. So this resource provides practical suggestions for what employers can do to support caregivers. It includes really great tools and templates to develop caregiving policies and procedures. It provides things like a work plan, job sharing options, and like a sample return to work plan. So very like hands-on, practical, evidence-based strategies that you can use in your workplace. The second one is a really innovative webinar that it discusses techniques utilized by companies like Starbucks and Google to boost workplace wellness. And leaders chat about 4-day work weeks, strategies being utilized outside of Canada to increase wellness and productivity. So I'm going to pass the mic over to Gabrielle, and she's going to share some Equity Link information and resources with you.
Bonjour everyone. Thank you, Melissa. So as Melissa mentioned, I will be doing just a quick overview of Equity Link because we want you to actually explore the platform yourselves. Equity Link is a newly added resource to the Burnout Toolkit in both the system and organizational level interventions. And Equity Link is a national online platform funded by Health Canada, so everything is free, through the Société Santé en français. The platform was developed by our French network, so the French Health Network of Central Southwestern Ontario, with the support of provincial and territorial health networks across Canada. So the platform was officially launched in 2021, and a new and improved version, you'll see a screen capture here on the presentation, was rolled out last May, so May of 2024, with an official relaunch a few months later, just this past October. So essentially, Equity Link is a resource and training site that's been developed to support health service providers working in diverse health systems by building their French language skills. Now, we say diverse health systems because when we think of healthcare, we think of hospitals, but we also dive into anything that is social services as well. So PSW, social workers. So we don't exclude anybody. It's really the health system in its continuum. So, and we also talk about French language services. However, the fun part about this platform is that it can be adapted to respond to the needs of other minority communities as well. Next slide, please, Melissa. So its main purpose is to answer the question that's frequently asked by health managers. So where do I start and how do I do it? So the site offers clear step-by-step guidance for managers looking to enhance their provision of French language services. And that's regardless of where the organization stands in their implementation process. So it offers a variety of courses who they all are accredited by the Canadian College of Health Leaders, and it supports the development and improvement of French language services in health, social, and even community services sectors. And additionally, the platform helps health managers assess their organization's current strengths and weaknesses regarding their French language services through a self-assessment tool. Now, this tool is designed to analyze your current situation and provide direction on where to begin. And ultimately, the main goal is to improve equitable access to services for Francophone and Acadian communities across Canada. Next slide, please, Melissa. Now, you might be wondering, okay, well, what is the link between language skills and bilingual health worker burnout? There's a lot of things that come into play. So we can talk about inadequate staffing, lack of specialized training, lack of proper support, as well as go as far as organizational health human resource policies that fail to account for the unique demands placed on bilingual employees. And all of this contributes to bilingual health worker burnout. So bilingual health workers often face added stress, for interpreting, translating, and navigating even cultural nuances, which can ultimately lead to emotional exhaustion, frustration, and then eventually burnout. So when bilingual staff members are not equipped with the right resources or training, they can become overwhelmed, and they're frequently asked to take on extra responsibilities without sufficient support. Next slide, please, Melissa. So by improving proficiency in French, staff will feel more confident and less stressed in their roles, leading to less burnout and healthier work environment. And as well, not to mention better patient and user care. Now, we've included a couple of citations here from the Knowledge Institute on Child and Youth Mental Health and Addictions. So the one in darker blue is regarding a larger caseload and added responsibilities, and the other one is more regarding towards fewer opportunities for advancement, which is something we don't really think of. Fewer opportunities for advancement because of the shortage of bilingual direct service providers. And why use EquityLink? Well, use it to plan, implement, and evaluate your French language health services with flexibility. You can identify your priorities through self-assessment, and you can even progress at your own pace. You benefit from ongoing support because you're not alone in doing this. This is a huge undertaking. So we have a team of experts that is there to support you throughout your journey to optimize the provision of French language health services. And as well to reduce diagnostic errors. I've had a few things happen to me personally as well in the healthcare system, misdiagnoses, for example. So to reduce diagnostic errors, lighten workloads, which we always love, and alleviate system congestion as well. Next slide. Also to access resources and practical advice that are validated by health organizations across the country. And also to easily explore a secure platform and take advantage of free training accessible from any of your electronic devices. Next slide. Now, the benefits for health managers and their teams by using EquityLink and its available courses, resources, and tools, health managers can ensure their teams are adequately staffed with bilingual professionals who feel confident in their ability to provide French language services. So this eliminates the stress of constantly translating or, feeling unprepared, helping bilingual workers focus on their primary roles. So this confidence reduces the emotional strain on bilingual staff and essentially lowering the risk of burnout and fostering a healthier work environment, and then also better care for French-speaking patients and users. So I'm not going to dive into everything because I really want you to go check it out. So we encourage you to start today by exploring the site at equitylink.ca. And to start your journey on the right foot, we recommend starting out with the self-assessment tool and the Equity Fundamentals course. So go check it out. And if you have any questions, I will be more than happy to answer them at the end of the session today. And I will give it back to you, Melissa, who I think you will speak on team level interventions.
Yeah, thanks so much, Gabrielle. I really appreciate you giving us more of an in-depth look at the equity resources. And the thing I love about the resource is it's so customizable. I like the fact that you give an organization like, here's where you're starting from and here's where you can go. One of the things that we notice when working with healthcare organizations is that they're really anxious to have something that's customizable for them. So every organization's at a different stage of their journey. And so kind of meeting them where they're at is super important. So thanks so much for sharing that. So we'll dive into 2 examples of team level interventions. So Beyond Silence is a team level intervention. It's a 2-day mental health training course designed specifically by healthcare workers for healthcare workers. It combines information sharing and skill development with strategies for stigma reduction. Topics include the mental health continuum, the impact of stress, how mental illness may appear at work, and how and when to support someone who's struggling. So sometimes in organizations, we recognize someone who's maybe having a hard time, but we don't know how to approach them and how to support them. So Beyond Silence really helps with that. Another intervention I wanted to highlight for you comes from Workplace Strategies for Mental Health. And it's an article that offers tips and strategies to balance and effectively support the success of employees who are working on site, but also employees who are working remotely. So we have to recognize that the new reality after the COVID pandemic is that not everyone is in the same building, working at the same time, in the same location. And sometimes it can be challenging to meet the needs of those who are working virtually and those who are working on site. So this provides some advice on topics like interaction, how to provide adequate mentoring, leadership, how to conduct team meetings virtually when you have some people on site, some people not. It talks about the importance of communication, how to create realistic expectations for those working virtually, and also the importance of checking in with those. So if you're not seeing your employees in a face-to-face manner, how do you check in meaningfully in a virtual environment? So those are just 2 team-based strategies that I wanted to highlight. There are probably over 100 different interventions on the Health Worker Burnout Toolkit. And what we found helpful when we worked with organizations was providing kind of a short list. So we went and talked to an organization and said, what are your needs? Where are your pain points? And after talking with employees and asking them, we would kind of choose 3 or 5 interventions that would really speak to their issues, just to kind of reduce that overwhelming feeling of all of the options that are out there. So we would love to open it up to a discussion with those who are here. We're curious if there's any interventions that kind of have piqued your interest or kind of resonated with you. And if there's any that you think would appeal to your specific organization that you kind of want to share with your broader team. And if you have any questions about Equity Link, the resources, Gabrielle is happy to answer them. And then our last question is just about what would help your organization act. So I know we've just provided you with a lot of information, but how do we take this information in a digestible form and actually bring it into action? So I'm going to stop sharing so that I can see who's with us. And yeah, we're happy to engage in a conversation. I can put the questions in the chat if that's helpful, but just curious if any of them resonated and what you want to hear more about. Sue, go for it.
Hi everyone. I'm Sue and I'm from Toronto Metropolitan University. I'm an assistant professor in the Daphne Cockwell School of Nursing. And I have a question, and I came a little bit late, so I'm sorry that I came late, but I had a question about, so I teach fourth year undergrad students and I also teach grad students. I have a huge concern right now about my students who are not even in the workforce yet, but they are, when we talk about concerns about their career, burnout, work environment comes up, but burnout keeps coming up. When I ask them about what they want for in terms of their ideal career, well, first of all, they don't want to work as nurses frontline. They look for opportunities like agency nursing or going back to school to become an NP. They want mental health support in the workplace. And my question to them is, well, what does that really mean in terms of what are you looking for? But I guess from what you've presented today, is there anything that you've come across? Like, what would you suggest as potential resources for this cohort of people who are not even in the workplace yet, already thinking about, they're going to work for 2 years and then they're off to something else. And a lot of my work focuses on work environment, quality of work environment, but this course that I'm teaching right now, this has really become quite noticeable. And I've talked with other nursing faculty from across the country, different universities, same issues. So that's my question. And I don't know if there's any resources that you investigated so far that would be helpful to students. My other question is then, how do we implement these? I see some of the things you've talked about are have been implemented, but I'm not sure if they're all healthcare organizations or some of them are more private sector companies, because again, I missed it. So I'll stop talking, but that was my question and comment.
Sue, that's a really great question, and that resonates deeply with me. And I think this is not just a healthcare issue, because I see it in the teaching profession as well. The messaging to students up and coming in any profession it's not a matter of, when you're going to burn it. Everyone's going to burn it, just a matter of when, right? So they're getting this narrative coming before they're even entered the profession that you're going to burn out. And so I think for me, I haven't come across a lot of resources that are preventative in nature for students. But one thing that I'm trying to do in teaching is just be a bit more preventative in the dialogue that we have in pre-service teacher education. And so one of the assignments that I'm encouraging all professions to use is called Fill Your Cup. And so they are required to demonstrate self-care to me throughout the entire term. And there's kind of a reflection piece at the end where they talk about what strategies worked well for them. How are they have to create a plan for themselves beyond the course. And I'm getting great feedback from students saying, years later, I'm still filling my cup. And it's something that I want them to do lifelong. Because if you think that it's difficult to be a student, wait until you're in the workforce. It's not any easier, right? So they've got to carve out that time before they enter the profession. The health worker burnout toolkit is specifically to healthcare. However, in another connected project, we talked about healthy professional workers. So we had 7 different professions, and nursing was one of them. So I can share the nursing toolkit with you. And I'm not sure if there's Houssem, you might be able to speak to if there's any nursing student resources in there, but that would be one place that we could add some for sure. I think there's definitely a gap that you've identified, Sue.
Mm-hmm.
Yeah,
I think I was just going to add too, they see it and they hear it in the people who are their preceptors, right? And so I think I teach fourth year, but I think in first year they may have a similar kind of assignment, but it's just concerning because we obviously, if we can't support them at this stage to graduate and have those skills to, support themselves. And if they don't get it in the work environment, then our cycle of recruitment retention doesn't necessarily work, right?
Absolutely. I would like to add something else also. Like first, like thank you so much so for these questions. I really like it because this is like I have heard like also that some students that shared with me the same thing that and especially when we see that we have the shortage and the crisis, especially that was exacerbated after the first wave of COVID-19. We are losing a lot of nurses, and we are losing also students, international students or, students that are local. And I think the professors play a big role in this stage that they need to support the students and they need to inspire them and share with them, this kind of resources. Like we have, like, as Ivy said, like we have like a toolkit. It's more about psychological health and safety toolkit that we developed with our partners. I think we play a big role here to support our students. Sometimes they will not like consult the toolkit because first maybe they don't have time or maybe they don't know about the toolkit that they exist. So that's why we need to play this important role and to try to share with them this toolkit and to say how we can accompany them to understand the toolkit because some people maybe they don't understand what the toolkit can benefit them. So I think that how we can implement it, maybe like to work with the dean and the faculty to see how we can implement this kind of resources. Maybe in there we can add them to the syllabus of courses, or like to do some promotion, in the screen of university. And yeah, so this is an important question I see, and thank you so much for sharing that.
And thanks for those links. Those are great. I didn't know about them, so I can definitely include those for my students this year and future for sure.
Absolutely. Thanks for getting the dialogue started too. I'm curious if there are any interventions that kind of struck a chord with you that resonated, or if there's any questions for Gabrielle from the Equity Link perspective, or if there's any experience that you want to share. I think it's great that we can connect and share experiences, because sometimes you hear it from someone, you're like, yeah, I've experienced that too. It's just nice to know that you're not kind of in a silo when it comes to dealing with burnout, because I think it stretches beyond healthcare at this point.
That wasn't directed at me, right? That was just for anybody to answer questions.
We're happy to hear from anyone, for sure. And I'm happy to share too, while everyone's kind of thinking, and I know it's hard when you put everyone on the spot. One thing that we learned from working with a couple different clinical sites was we wrote a paper called "Even If You Build It, They May Not Come." So even though there are all these virtual toolkits and resources, I think sometimes they're collecting, virtual dust on the web. There's people, it's hard to get the traffic to come to these sites and to use these resources. So even when we have the best intentions and we set up all of these resources, how do we get people to actually click on them and use them? And I think for us, the real key was relationship building. So we built a relationship with the organizations that we were working with. And once we had that relationship of trust and we kind of listened to what they had to say, because oftentimes we do a lot more talking than we do listening. But if we actually sit down and listen to what students have to say, to what organizations have to say, we can really help pair the resources with the concerns that are being expressed. So I think also looking at how to optimize the services you currently have at your organization. How can you tap into what you're already doing well to make things better? Because often we look at it from a deficit lens, like, oh, we don't have this, we're missing this. But if we can optimize what's already working for the organization, that can be super helpful as well. And I think reaching out to leaders, that we're here to help. Leaders sometimes feel burdened, or middle management feels burdened with frontline staff concerns. And sometimes leadership's struggling too. So letting leaders know that, we're here to help you, we're here to support you. Because I think leadership's feeling burnt out as well. Yeah, go for it, Sue.
Sorry, the mouse wouldn't land on the microphone.
That's
No,
okay.
yeah, I would agree with you. I've done a couple studies during the pandemic with leaders, mostly frontline leaders, not senior executives, but So you're right, they also are feeling quite burnt out and have their own need for resources. One thing that I just thought about within the academic setting is sharing these links with the student support centers. So student support centers, I'm sure most universities have those, right? But if we want more specifics for the healthcare professional groups, we could share these links with those staff as well, so they could then, keep spreading that around too. So that's just
That's a great idea. That's a great idea, Sue, because I think sometimes as researchers, we have the best intentions and we want our information to land in the right hands, but it doesn't necessarily get there, right? So connecting those bridges and making those paths between research and application can be crucial. If we have a workforce of nursing students who are struggling and they're not getting the information or the resources they need, that's not setting them up for success to enter the workforce. So I think that's a really great point. Any other thoughts or experiences anyone wants to share, or any questions?
I would just add I can also look for some resources from this toolkit, are specific more to academic, and then I can share it with you, Sue. So this could be helpful also to share it with with your student or the staff there.
Yeah, and I'm the president-elect for the Nursing Leadership Network of Ontario, and so we have a conference in April, and Ivy's actually one of our keynotes. But that would be another group that we can share these resources with, because many of the people there will be in various leadership roles, some frontline, some maybe more senior level. But again, just trying to get out, get the links to these resources out there would be, I think, helpful to various groups. Hello, Ivy. I see that you're there now.
Yeah, no, thanks. And I think it's really important in a lot of our work, whether it's the Healthy Professional Worker Project, the Health Worker Burnout Project, the Psychological Health and Safety Project, where we develop toolkits, the importance of leadership, right? Leadership of those who are, in practice settings, but also leadership within academic institutions. Because you have to sort of affect a culture shift. So you need to have a multiple intervention strategy. You need to focus on those who are out in practice, particularly as they are the preceptors for different health workers, but also getting at interventions in early in education programs. And so some professions are much more further along that pathway, and some are just stepping on the pathway. This conversation that we wanted to have with Gabrielle and her organization is to recognize the additional stressors of being in a bilingual environment. And although we are talking about this within the context of a bilingual French-English environment, and there are unique circumstances, in the National Capital Region, possibly also in Montreal. If you're looking at any language, right, and having more than one language, just recently came back from British Columbia, the importance of having accessibility in other languages other than French, and how important that is. So we wanted to highlight that. And I think that we don't do a very good job in Canada of planning in general, but we definitely haven't sort of been capturing data on the language capabilities of different health professionals. And so how someone has their regular high stress workload, and then they are often kind of pulled into conversations based on their language abilities, and that ends up being, really quite ad hoc. And so we wanted to look at some of those unique experiences as well. So I'll pass back to the team.
Thanks, Ivy. That's a really great insight. There's definitely a lot of additional stressors that we don't even think about until someone's put in that position. But yeah, just curious if there's any other thoughts, questions, before we kind of wrap up and give everyone a chance to finish their lunch. Go ahead, Patrick.
Hi, thanks so much for the presentation. It was really interesting. Just was wondering, in terms of the bilingual piece, was it mainly English and French that you were looking at, or other languages? I'm just curious in terms of how others from different cultures like might even perceive this idea of burnout, and whether you've identified any differences in that component as well, because that might impact how people take up that concept and are receptive to strategies.
Yeah, that's a really great question. For the health worker burnout toolkit, we just focused exclusively on English and French, but I think you're bringing up a pretty important point that from a cultural perspective, I would imagine that burnout would look and feel quite differently. So that's something that we could definitely keep in mind and explore for the future, for sure. Any other final thoughts or questions? All right. Well, thank you so much to everyone for attending, for participating and listening and engaging. We really appreciate you coming and spending time. And again, the webinar will be happening en français next Tuesday at noon. Gabrielle and Houssem will be hosting that one. I will be off on the sidelines practicing my French. So thank you everyone so much, and enjoy the rest of your day.